Hello, my name is Dr. John Wessling, and I'm a chiropractor, and I've been in practice here in the Wichita area since 1975. And a part of our practice is for the treatment of carpal tunnel. Now, carpal tunnel syndrome occurs when the median nerve that runs from your neck passes through your collarbone and then down the center of your forearm and into the carpal tunnel of your wrist and then into the hand muscles becomes compressed or squeezed. Now, the primary symptoms of carpal tunnel syndrome are pain and numbness in the thumb, index finger, and middle finger, often worse at night, and then may radiate up into the arm. Now, frequently you may wake up feeling the need to shake out your hand or your wrist, and as symptoms worsen, you might feel tingling to the day with decreased grip strength, making it difficult to form a fist, grasping small objects, or performing manual tasks. Now, it has generally been agreed upon that the cause of carpal tunnel is a trapping and pressure on the median nerve as it passes down here through the wrist. And medically, surgery is performed which widens and opens the carpal tunnel in the wrist to unblock the passage for the median nerve. These surgeries sometimes provide relief, but sometimes they do not. And according to the Journal of Hand Surgery, the surgical success rate for carpal tunnel is only 54 to 56%. And surgery for carpal tunnel costs about $6,000 to $10,000 plus the cost for rehab and lost wages, which can total about $30,000 to $40,000. Now, the reasons for the failures, according to the experts, is that the cause for carpal tunnel located in the surgical region of the wrist occurs in only a few cases. In most cases, the problem can exist anywhere along the course of nerve as it reaches the wrist. The nerves that end up here in the wrist and fingers that travel up the arm to the forearm and the upper arm originate up here at the base of the neck. And in most cases of wrist pain, finger numbness, and carpal tunnel, the median nerve becomes irritated or damaged somewhere along its pathway as a direct result of overused muscles and tendons. They run through the muscles of the shoulders, upper arm here, down to the forearm, and down here into the wrist. And it can be from multiple things, but what comes to mind first is the constant contraction of the flexor and extensor muscles into the fingers and forearms, which develops most often in people who regularly use vibrating machinery and tools, and those who use the wrist repetitively, such as accountants, painters, writers, assembly line workers, truck drivers, carpenters, and also computer operators. So if you are wondering what's happening down here in the soft tissues, down here in the muscles of the arm and forearm, is the fact that when your arms and forearms are required to do a lot of work, it doesn't get the time to rest and recuperate as it normally would. Just as when you sleep, your body recuperates and your muscles need the same as well. Now, when it doesn't have that time to recuperate, it doesn't get the nerve and blood flow that it normally needs. And when you have that constant contraction or constant demand, you cut off the blood and nerve supply, which pretty much is starving the tissues, making them more prone to injuries, which causes a lot of buildup of scar tissue and tightness in the muscles. Also, another reason is having a metabolic problem that could play a role in carpal tunnel. Diabetes and gout can affect the joints and nerves of people affected by it, and as a result, carpal tunnel syndrome sometimes becomes a secondary condition. Now, initially, one of the most important modifiable factors is rest, and as I mentioned, rest is when your body can recuperate, and the same goes with your muscles as well. And if you don't get this rest, then it lends itself to the starvation of the tissues in your arm and forearm, which leads to scar tissue and tightness in the muscles, and then further injuries. Now, in the case of a carpal tunnel patient, they are most likely in this position, hovering over a computer keyboard all day long, and they are constantly contracting these extensor muscles here into the forearm and wrist. Now, stretching is good for prevention, but when carpal tunnel syndrome has already developed, stretching is not very effective because of the scar tissue and tightness here into the muscles. It's hard to stretch out scar tissue on your own. A muscle that has scar tissue is similar to a rope that won't stretch out and lengthen, and the muscles become shorter and weaker. Then you have tension on tendons causing tendinitis, and then the nerves become trapped. Now, a normal healthy muscle is similar to a rubber band that is stretchable and will lengthen. Now, if you can imagine a muscle with inflammation and scar tissue, it will not stretch out a lot, but a healthy tissue and healthy muscle will. Now, in our office, we use multiple therapies in the treatment of carpal tunnel and soft tissue injuries. One of the therapies we may utilize, depending on your history and examination, is pressure point therapy, which is one of the most effective and efficient, and it is the most specific type of tissue work there is in reducing inflammation and scar tissue causing carpal tunnel. Also, because of the risk factors that contribute to carpal tunnel, like diabetes, gout, poor nutrition, and vitamin deficiencies, we are going to treat you metabolically as well. A lot of times, you may not realize that what you eat causes you to have inflammation, which can irritate the sensory pain nerves going down here into your arms, even though the pain is referred from elsewhere. Now, if you suffer from carpal tunnel and you are looking for a doctor that will sit down with you and find out who you are and how you have been treated and be able to provide you with some hope, then please fill out the area below for a more detailed explanation of all the different treatments that we do that makes our care so unique and successful.